I'm Dr. Ravi Shankar, consultant neurologist and stroke specialist. Today my talk is about stroke unit composition. So for this presentation, I don't have any disclosure. The objective of today my talk is what is stroke unit? Stroke unit होता क्या है? और जो भी स्ट्रोक पेशेंट्स होते हैं अक्यूट केयर के, क्रोनिक केयर के, इन सब की अगर स्ट्रोक यूनिट में केयर की जाए तो उससे क्या बेनिफिट होता है, और वो पेशेंट अगर मेडिकल वार्ड में जाते हैं या मेडिकल आईसीयू में जाते हैं तो व्हाट्स द डिफरेंस. सो व्हाई वी नीड स्ट्रोक यूनिट to treat acute stroke patient in a stroke area, and what are the components what we require to establish a stroke unit in the hospital, what was the evidence which support the stroke unit, and what are the goal of the stroke unit, and what was the requirement of a stroke unit. So stroke, it's one of the leading cause of the disability, and it's a long-term serious disability that affect that may affect maybe a prolonged with physical, emotional, social, and financial consequences, not only for the affected patient but also the family and caregiver. So it's a huge burden on the patient as well as caregivers. So stroke is a multidisciplinary team approach which provide working with the fundamental to deliver effective care across the stroke pathway. As we know, stroke is a leading cause of death and disability worldwide, and out of them, 1/3 of the patient who suffer from stroke has been die, and 1/3 will live with more or less severe impairment, and 1/3 who will be recovered and have a complete recovery. The best chance for recovery from stroke are given when the patient be treated in a stroke unit. Only 30% of the patient in the European country will be admitted in the stroke unit in the European country. So what about the our country, which belong into the low and middle income country across the world? The definition of the stroke unit is a specialized geographical defined hospital unit dedicated to the management of the stroke patient during the first few days or longer following an acute stroke event and staffed by a professional team. Integrated stroke unit means hospital who have a stroke unit along with the rehabilitation unit, and the both combination we call is integrated stroke unit. A stroke unit in a hospital is a dedicated ward which assigned to deal with only the stroke patient, and you have one stroke neurologist or the general neurologist who have experience within the field of the dealing with the stroke patient, and the stroke trained nurses. ये is a very important, ये बहुत important है कि स्ट्रोक यूनिट के लिए आपको न्यूरोलॉजिस्ट स्ट्रोक तो चाहिए, लेकिन आपको एक स्ट्रोक नर्सेस चाहिए, क्योंकि सारी स्ट्रोक की पेशेंट की केयर, उनकी मॉनिटरिंग, all about we are depend on the nursing care. Nursing care is very important to prevent every complication after the stroke patient and dealing with the stroke unit. You also need some rehabilitation department, which included the physiotherapist, occupation therapist, speech and language therapist, rehabilitation physician. Nowadays, the CPSP having doing FCPS in the rehabilitations. Dow University is offering a rehabilitation FCPS, and many of the candidates they are doing FCPS in rehabilitation medicines. So they are very important area we look into, and we will increase awareness about the rehabilitation facilities in our country. Social workers and paid coordinators. The protocol also you have to follow, and any of the hospital who required a stroke unit or who have a stroke unit, they have a direct admission from the emergency to the stroke unit, monitoring facilities and multidisciplinary working, active involvement of the patient and career in the management. This is the meta-analysis of the stroke unit care patient who had been in a stroke unit and versus the general medical ward after a median of 1 year follow-up. So look into the numbers. The death will be higher if patient will admit in the general ward, but the number will be less if patient is admitted in the acute stroke unit. So this evidence will show that the number of the death, number of the dependency, they also have a lesser patient with treated in stroke unit. But the home independence number will be increased. When more patients they are independent if they are treated in the stroke unit. This is the 23 trials analysis, and that will be based that shows the information on the last previous slide that number need to treat to prevent one death if you are treating patient in stroke unit is 33. And if you treat one patient unable to stay home is 20. And you treat one patient to falling to regain independence is 20. This is another study, American Heart Association, which shows the benefit of the implementing of the stroke protocols and treating a patient in the stroke unit. That shows the post-stroke complication rate, morbidity, mortality will be lesser if patient treated in stroke unit. The recent Cochrane review that include 21 trial that include 4,000 patients comparing the stroke unit care with the general ward treatment shows consistently improved outcome for stroke patient. Patients are more likely to survive and become independent if you are treated in a stroke unit. The first stroke unit was established in the 1980 in the first Scandinavian country, and then followed by the other developed countries like Germany and UK in 1990. Stroke unit are a specialized center and dedicated bed offering a multidisciplinary treatment of a stroke by dedicated stroke trip addressing the acute treatment as well as early rehabilitation and secondary prevention. Stroke unit provide a good quality evidence, confirm that a stroke patient who are looked after in a stroke unit are more likely to survive and be independent and living at home 1 year after this stroke. The apparent benefit, which was independent of the patient age and stroke type and initial stroke severity. The goal of a stroke unit, any hospital which have a stroke unit, they have the monitor parameter, like you have the monitoring of the rhythm, ECG, we have monitored the vital sign like pulse, blood pressure monitoring is very important after acute stroke care. And even the after the acute stroke care, you even need more vigilance monitoring of the blood pressure, respiratory rate, oxygen saturation, temperature, glucose in order to prevent and treat the complication. Hospital who have a stroke unit, they provide the thrombolysis treatment of the patient within a time window, 3 hours and maximum 4.5 hours. If they have a facility to provide thrombectomy, if possible, to identify stroke causes in order to provide a target treatment. And stroke unit patient, you have an early mobilization and rehabilitation. That's very important in the recovery of the patient. To provide secondary prevention in order to prevent infarction, progression, and recurrent event. The requirement of any hospital who is establishing stroke unit, you have required a staff requirement. The staff include a neurologist, either general neurologist or stroke neurologist, should be committed to provided a care of acute stroke care 24/7 on call outside regular duties. You need also support by other physicians in the hospital like cardiology, neuroradiology, neurosurgery, all on call if you have treating and provide a stroke care in your hospital. This is a very important that you required staff training. ये हमारे कंट्री में बहुत इंपॉर्टेंट है कि हम अपने स्टाफ को स्ट्रोक केयर के लिए ट्रेन करें और हमें हर बेड के ऊपर हमारी कंट्री इतना अफोर्ड कर सकती है तो हम वन इंटरनेशनल स्टडी कहती है कि 1.5 to 2 नर्सेस पर बेड, बट अगर हमारे पास 1 नर्स 1 बेड भी है तो भी काफी अच्छी केयर हम स्ट्रोक पेशेंट को स्ट्रोक यूनिट में दे सकते हैं. बट दे आर ऑल द शिफ्ट्स, इट्स नॉट कि हम मॉर्निंग शिफ्ट में स्ट्रोक नर्स है, नाइट में कोई और नर्स आ जाती है. इट्स 24/7 यू रिक्वायर्ड स्ट्रोक नर्सेस सर्विसेज if you are treating patient in a stroke unit. The stroke nurses should train to assess the patient clinical examination, how to assess the GCS and ISS score, monitoring vitals, and also know the procedure how to react the increase in case of complication like dehydration, aspiration pneumonia, deep vein thrombus, blood pressure fluctuation, and the progression of the stroke or the recurrent stroke or the rise in blood pressure. The staff should be trained to pick off all of these complications if the stroke patient have any of them during hospital stay. The rehabilitation unit is a specialized geographical defined rehabilitation unit dedicated to the rehabilitation of the stroke patient only. The rehabilitation team included the physiotherapists, speech therapists, occupation therapists, social workers, They're responsible for the early mobilization, recognition, and the treatment of dysphagia. The organization of discharge management and planning of post-acute rehabilitation. Stroke unit consists at least a 4-bedded located in a dedicated area in your hospital. It may be increased due to 6-bedded, 8-bedded, 10-bedded, but minimum you require 4-bedded area dedicated to the dealing with the only stroke patient. All beds have to equip with the monitoring facilities and the oxygen and the 1 or 2 ventilator in case of backup patient. You need a ventilator requirement. In a hospital, you have the facilities available like an imaging facilities, CT scan, CT angiogram, if available, CT perfusion, MRI imaging, if available, color Doppler, and the atrial fibrillations, and echocardiography, and clinical emergency laboratories facilities of dealing with acute stroke in the initial phase. In order to review procedure, you need a certification to register your stroke unit into international, meet the international criteria to provide a best practice should be considered. Like many of the international organizations, the European Stroke Organization, American Stroke Organization, the Pakistan Stroke Society, you need a certification of your registered, your hospital stroke unit. That way, to improve the quality of the care and delivery the proper care, and you follow the protocol, and that also important in the research activities. Certificate is not a name by itself out, but can provide a systematic feedback as well as it can demonstrate a degree of excellence of the stroke services. How to set up a stroke unit? For the stroke setup, you need a dedicated area of the minimum 4-bed or 6-bedded. You need a training of your general physician, the duty doctors, the neurologists, the resident. Stroke neurology, you require the help of their experience. You need a dedicated bedded diagnostic facilities and monitoring equipment. And within a 6 months, you have the standard operation procedure and the following the protocols and manuals in your hospital. And implementation of that protocol and following the standard operation procedure and training of your staff is very important. And within a 12 months, you need a registry of your stroke unit within affiliated organizations, and then followed by you provide a good care in your hospital. What are the benefit of the stroke unit? That improve the quality of the stroke patient and reduce the mortality, reduce the complication, facilitated patient access to thrombolysis, and then that know, okay, this is a hospital where stroke unit is available. They provide acute care, they provide a post-acute care, and also the secondary prevention of the further stroke. The specialized stroke team is available in that hospital. Timely evaluation, आपको टाइमली चेकअप हो जाता है, टाइमली पता होता है कि स्ट्रोक यूनिट है, हमें टीपीए मिल जाएगा, हमें इंटरवेंशन मिल सकती है। अगर इन केस हमें ये दोनों ऑप्शन अवेल नहीं करते किसी कंट्राइंडिकेशन की वजह से, तो बाकी की जो केयर है उसके हिसाब से भी स्ट्रोक यूनिट में जो पेशेंट की केयर होती है उसका सर्वाइवल, उसका आउटकम, उसकी डिसेबिलिटी काफी बेहतर होती है। Improve early survival across all the age groups, most cost effective than care on other hospital and ward and team. ये वो cost effective है। अगर आपका patient किसी और medical ICU में है and you compare the cost, that the cost in the stroke unit is lesser than the cost you pay in the other hospital medical ICUs. Reduce incidence of post-stroke complication, UTI, pneumonia, or death. As we share our hospital experience, I'm running a stroke unit at South City since last 4 years. We have a 6-bedded unit. All are the monitor equipped, and we have ventilator backup support of the 2-bedded. We have a stroke skill and competency staff. I have trained them, of my staff, to how to deal with the stroke patient, GCS monitoring, NIS score calculation, complication picking, and it's a multidisciplinary team. We have a team support of neurosurgeon, radiologist, cardiologist, and provided IV thrombolysis since last 4 years. And we have to admit direct patient to the from emergency to the ICU, stroke ICU or stroke unit, manage all post thrombolysis complication as well. We have a team to provide thrombectomy service to the patient, but that is in our plan. Maybe we recently or very soon we started this thrombectomy service in the hospital. Manage of the other part of the stroke is a hemorrhagic stroke as well. We have admitted hemorrhagic stroke as well. And the rehabilitation service, we have a speech therapist, we have a physiotherapist, occupation therapist, and the bed coordinator health services. This is a picture of my stroke unit. There are 4 beds are looking and 2 are the behind. Each bed is assigned to be a 1 staff, and they all are dedicated to deal with the only stroke patients. This is stroke patient. We have equipped monitor bed, all of the facility inside. The stroke nurses is there, stroke patient. This is my stroke team that is the head nurse of the stroke unit. This is the staff. This is the occupation therapist. This is a physiotherapist. This is a bedside nurse during that time. And this is the doctors. We are working in the hospital, and they haven't, I haven't then teach them about the protocols of the stroke, and now they are very much trained dealing with the stroke patient in a hospital. This is a stroke service coordinator, which provided the service and the awareness and information regarding the admission policies and the stroke and rehabilitations. So summary of my talk is stroke unit care is very important, which improve quality of stroke life patient, lower recurrence of the stroke risk and complication, earlier rehabilitation, low risk of mortality, installation, greater use of acute stroke treatment, and increased number of stroke unit in country we required. Here we are talking about stroke unit, but the country all over the world, they are moved toward the mobile stroke unit. बाहर तो अब मोबाइल स्ट्रोक यूनिट की बात हो रही है, हम यहाँ पे अभी स्ट्रोक यूनिट की बात कर रहे हैं कि हम अपने कंट्री में और डिफरेंट हॉस्पिटल में स्ट्रोक यूनिट एस्टेब्लिश करें। वहाँ पे तो जो स्ट्रोक स्पेशलिस्ट हैं या स्ट्रोक फिजिशियन हैं, उनके जो ट्रेन डॉक्टर स्टाफ हैं, वो इस एम्बुलेंस में हर चीज़ अवेलेबल होती है। इवन दे डू अ सिटी स्कैन इन द मोबाइल स्ट्रोक यूनिट्स। सो वहीं पे टेली कंसल्टेशन होती है न्यूरोलॉजिस्ट के साथ, रेडियोलॉजिस्ट के साथ, और उनकी ट्रीटमेंट वहीं मोबाइल स्ट्रोक यूनिट में शुरू हो जाती है। I'm feeling very pleasure and glad to disclose this slide because one of my colleagues, Shoaib Hassan, have recently established a stroke unit at the South Punjab and Nishtar Medical College Hospital. So this is a 6-bedded. He was showing that he's started a stroke unit, much needed in that area. So it's a recently inaugurated new stroke unit in the Multan. So I'm just sharing that, nowadays with this platform, we provide a great awareness and great services to establish the more stroke unit in all over the country to provide a good and accurate treatment to all of the needed stroke patients. Thank you.